small vessel disease, covert small vessel disease is a huge topic because it's a very frequent condition in the general population, and you might find it in many people. And the strange thing about covert small vessel disease is that you actually cannot anticipate which patients will have it. So many people come to your attention by bringing you some brain MRI they performed for ascertainment for incident cases that or symptoms that were not related to small vessel disease, and they can come to medical attention by bringing you directly the results of neuroimaging. So it's a very interesting topic on a clinical point of view, because we have to manage patients that have an incidental finding in most cases. Despite that, it's a rather prevalent condition. So the European Stroke Organization find it useful to issue some guidelines for the management of such patients, and the result of those guidelines is that you don't have to do very much actually, except from strict control of their vascular risk factors. And an interesting thing is that you don't have to treat all of them with antithrombotics, because antithrombotics can actually be harmful in some of them, because they are linked with hemorrhagic risk together with their associated degrees of ischemic risk. So you have to be very careful about the evaluation of these patients. But we have few therapeutics decisions to make, and the best thing is to follow them up over time for the accumulation of vascular risk factors and the strict control of them, especially with the arterial hypertension. So my specific topic was a clinical one. And was about the opportunities of setting up a clinic for covert small vessel disease. I spoke about selection of those patients, how should we select them, and how should we manage them. There are many ways of managing them, especially with the control of their vascular risk factors, but there are less clear criteria for the selection of these patients in terms of how to pick them up from the general population and set in a specialist multidisciplinary clinic. There are no definite criteria, but maybe the best one is to select them based on the presence of vascular risk factors, and especially arterial hypertension. Maybe many people with arterial hypertension should be screened for the presence of covert small vessel disease, and on the presence of subtle clinical symptoms that can be missed, such as transient symptoms that could be unnoticed, or the presence of depressive symptoms that cannot be explained other than with a vascular cause or subtle cognitive decline.